Welcome to watch Clearmind's mental well-being and health videos. I am Satu Kaski and now I am talking about mental health in sport. Content today is talk about mental health problems in sport in general level, also some typical so-called silent signs and what can you do if you have some concerns about athletes' mental health problems. First, something in general level when talking about mental health problems in sport. First, it is very important to notice that mental health symptoms, they are very common among elite athletes. For example, depression, anxiety, and eating disorders. We did our research in Finland and we found out that approximately 24% of our elite athletes did have symptoms of depression and anxiety, and we did use clinical psychological valid measurement. And also it is important to notice that it might be very hard to seek help. So shall we say, dare I seek help to my problems? Still, there are some fear of stigmas, and also there might be, shall I say, beliefs that if I seek help for mental health problems, it means that I am very weak. Or, of course, there might be some fears that if somebody knows that I have mental health problems, it means that I can't get contracts anymore, etc. So this is very important to notice that it might be very hard to talk about that I have some problems. And also thinking about us as a mental coach and sports psychologist and coaches around athletes, it might be that we underestimate those symptoms. For example, it might be very hard to recognize that when an athlete talks about that I am very tired or a little bit exhausting, we might normalize it like, well, this is the time of the season, it's quite normal to be tired at that time, for example. We do recognize if you have depression or if you have eating disorder, if you have anxiety, but those little signs that are very important to notice, it might be that we underestimate it. And of course, it might be also hard to find help. Talking about money, so the funding might be there, or it might be that we concentrate on mental skills, not focusing on those causes behind the symptoms, for example. And it is very, very important to recognize that there might be situation where you don't have the clinical sports psychologist, for example. And we have developed and we have an organization, UTHA, OY, meaning athletes, artists and those who work in peak performance field. We have developed this kind of a mental health care center where we are focusing on clinical sports psychology issues. And then what are those typical, shall I call, silent signs? For example, if you notice something different on your athlete's behavior, for example, she or he is not talking as normal, or there is not the eye contact as there used to be, or it might be that the way she or he act, or like a posture or weight, of course, or of course that the performance varies surprisingly. So there might be little signs. They are not all the time marks that you know that now something is wrong. And my advice is do not hope the best. Check it. If you are concerned, just ask. And of course, if you are worried about your athlete's mental well-being anyhow, for example, there are some sleeping difficulties or overtraining, or there is a little bit more anxiety, or you notice that the mood is down. And of course, if something sudden happens, that could be traumatic for the athletes. Injuries, those so-called close-up situations. As we all know, we do know that man can not distinguish between what is really happening or what happened really and what, shall I say, almost happened. So the marks inside are the same. So it's very important to check those out. And of course, if you suspect he or she is dependent on drugs, medicine, pain medicine, for example, alcohol, games. This is a few examples what might be those signs. So, what to do? Of course, be present so that there is nothing wrong about having mental troubles. So it's very important that you show that you care. And tell your athlete that help is available. And of course also support in applying for help. And hope you have somebody near you. So to call and contact the healthcare center, for example, clinical sports psychologist. Or you might have the sports psychologist or the mental coach who will contact the mental health care center. So it's very important that there is a lot that we can do about that. And you are worth of that. Hey, thank you for watching this video. And if you like the video, just thumbs up, and also please be free to leave topic suggestions over there in the comments below. Thank you.